I'm going to give you kind of an overview of the insurance market in Utah and what's going on and how to get coverage and kind of what SB 57 was about, and also about Medicaid. Some pretty big news there. So this is actually from the Department of Insurance Health Insurance Market Report, and it's data from 2013. So this pie represents the population of Utah. Back then, 2.9 million people. That's really complicated, so we're not going to look at that. It can be really simple if you look at it the right way. Basically, the part in red is stuff that our state legislature couldn't pass a law about. It's self-funded and it's all these other things. The part in blue is something they could cover. So that's about 27%. We passed our law in 2014. SB 57 affects state-regulated plans on everything except the small group market, which back then was 2 through 50. And basically, the legislature wanted to protect small businesses. They were worried about them. They're afraid that this is going to break the bank and whatnot. We don't think it will, so we're going to find out. It goes into effect in January. So a little bit of bad news, not a lot tonight. The small group market's been redefined to be 2 to 100 instead of 2 to 50. So that's what the difference between those two. It's not a lot, so we went from 20.6 of the market down to 19.9. That also goes into effect in January. Some really good news, because of a law passed in 2012 called SB 138, any health insurance mandate that passes in Utah has to cover basically all state employees, school districts, state higher ed, and CHIP, the Children's Health Insurance Program. And that's really good news. And actually, when the legislator proposed that, he said, look, if we're going to mandate that private insurance has to cover this, we should step in there and cover this for state employees. And he said it was important. And at the time, it made it a little bit harder for us to pass SB 57. But now that both things have passed, this is great. More good news. Medicaid covers autism up to age 21. This has been going on for maybe a month now, something like that. They announced the plan over the summer. And this is basically because CMS sent out a memo saying, hey, we need to cover this. And the states have been a little slow getting to it, but Utah has done a really good job, as far as I can tell, about setting up this coverage. And we're going to talk about what that looks like a little bit later. They're federal employees here in Utah, and state laws don't apply to their FEHBP. They cover in some parts of the United States. I don't believe they do right here in Utah right now, but they've been talking about providing coverage for a couple of years, and the language is getting stronger and stronger. We're going to find out in about a month, I think, what their plan for 2016 is going to look like. Self-funded plans, that's about 31% of the market, and they're governed by a completely different set of rules. It's basically when an employer is big enough that they have enough employees that they're covering, they can have their own risk pool, and they go by something called ERISA regulations, and that has to do with like retirement or something, but basically they don't have to go by state law. Fortunately, there are employers like Adobe who choose to provide this coverage, and we really appreciate that. In fact, if you look at Mike, what is it, 70% of the Fortune 500 provide some kind of autism coverage?
Some kind of coverage.
Some kind of coverage, not necessarily behavioral therapy. It's more like 30% that provide behavioral therapy. There's still a lot of uninsured people in Utah, 11.6%. The legislature has been talking about it, Healthy Utah. I know I talked to Senator Shiazawa earlier today, and he's talking with people tonight, and they're going to be talking tomorrow, and hopefully they'll come to some kind of resolution. The remainder of the market is about 11%, something like that. Medicare, HIP, PCN. Medicare is by far the biggest chunk of that. And of course, Medicare is for mostly for people aged 65 and older. So, this pie chart shows you one thing, but the big green chunk in there, about a quarter of that or a fifth of that is CHIP, and that's all children. Anyway, so we don't have complete coverage. We're working towards that. Every time somebody adopts, somebody like Adobe comes out and says, we're going to cover this, that's good for everybody. And with Medicare providing that kind of coverage is really great. So the more we get, the better. So who's covered? We just went over what the different parts of the plans are, state regulated plans, blah, blah, blah. I should mention that public charter schools are part of that too. And I say that school districts are providing coverage. That includes public charter schools. So that coverage begins when a plan renews after January 1, 2016. So it doesn't automatically happen on January 1st. It's when your plan renews. CHIP, for instance, begins in July of 2016. I think a lot of school systems, they hire teachers and then they start their coverage in September. So that's when a lot of school plans renew. You just have to look at your policy and figure out when it is. You need an ASD diagnosis. Under the law, it says that it has to be the most recent version of the DSM by a qualified person, and it kind of spells out what those are. It's going to depend on your insurance company. If you have a DSM-4 diagnosis, they may take it, or they have to pay for the diagnosis, so you would think they'd be willing, but who knows what they're going to do. We're going to talk about some of the things that insurance companies do in just a minute. The age limit is 2 through 9. I wish it was higher. This is the best we could do for now, but we'll keep trying. So the coverage includes diagnosis, pharmacy, psychiatric. Oh, you can read the list. Well, some of you can't probably. Psychological therapeutic care, including occupational therapy, speech therapy, and/or physical therapy. It includes behavioral therapy provided by or supervised by a BCBA or licensed practitioner of mental health services. The language is a little vague there. Behavioral therapy is limited to 600 hours per year. I know that's not a lot. That's about, if you have a 2-week vacation, that's about 12 hours a week. And we know that's not intensive, but it is something, and especially if your kid is of school age, that might be a good summer program. And we can always work at increasing that in the future. One thing is how often they can review your treatment plan. You have to have a treatment plan in place that kind of says what your goals are and things like that. And if you, I would make goals to, progress in these areas and to maintain things, because sometimes we get regressions and whatnot. They can't do it more frequently than 6 months. There are a bunch of facts about this on our website. The Department of Health and the Utah Autism Initiative, a bunch of people there, a subcommittee, put together this FAQ. I kind of shared it early on our website. They just released theirs today. So you can look on our website and there's a link to that FAQ. Medicaid coverage. Covers ABA, covers speech, OT, and it's available to people up to age 21, which is great. They specify what kind of test you have to do to get a diagnosis. They also said, everyone knows about the Medicaid waiver that was in place for a few years, right? That covered around 400 kids, I think. They expect this is going to cover around 4,200 people. So that's a pretty big positive change. I know that they're letting kids who are currently on the waiver age out. They're just not accepting new people. And they've also said that if you have a diagnosis under the waiver, you're not going to have to get a new one. And as far as I can tell, they're doing a really good job with all of this. The individual behavior therapy is limited to 30 hours a week, but if you need more, there's an avenue to get more. And I think that's great. I know there are options for group therapy because I saw some billing codes for it. Bottom of that web page, or at the bottom of this page, there's this is where I got this information. They have a FAQ there and whatnot. So lots of stuff there for both parents and providers. How do you get Medicaid and CHIP? CHIP is actually kind of a good deal. I think it's around, the most you'd pay for it is $75 a quarter. And here's the income limits. If you look at both Medicaid and CHIP are based on the federal poverty level. And you can see the numbers at the bottom of the screen. You can pick out for a family of 4, they can earn up to a gross of $24,250 a year, which isn't a lot, but for CHIP, you can go to 200% of that. And that works out to $48,500. Medicaid has stricter requirements, so if you earn less, you can maybe qualify for Medicaid. But CHIP is a real possibility that people should take a look at. If you have a family of 8, you could earn $80,000 a year and get CHIP for your kids. And CHIP is going to follow the SB 57 rules. So Medicaid is the really good insurance, but CHIP is there and can give you help. Improving SB 57, we all want to, and I think private insurance should be at least as good as Medicaid. We'd like to remove the age caps, remove the treatment limits, renew it with no sunset and no fuse. I call it a fuse. We'll talk about what that is. SB 57 has a sunset clause. Unless it's renewed, this law is going to end on January 1 of 2019. We'll work to get it renewed, and I think with things like this, it typically happens. I think we're going to have good results from it. People are going to like this. Legislators were very positive when this was passed. Like they felt good about passing this bill. Repeal, any law can be repealed. Nobody's talking about that. There's a clause in there about the Attorney General issuing an opinion on whether this is compliant with federal regulations. We're pretty sure this is compliant with federal regulations, and the Attorney General hasn't said anything. We're not worried about that. In the event of a 1% premium increase, that can make this law stop, essentially. Data from other states show that this is not going to happen. The premium increase would be on the order of 0.1% instead of 1%. We kind of assume that Utah is not that different, even if our rate is a little bit higher. So we don't need to worry about that. If you don't have insurance already, you could conceivably buy an individual plan. Anybody could buy an individual plan for their kid on healthcare.gov. Okay, so healthcare.gov had some problems when it first started, but apparently you'll be able to do this. Open enrollment starts on November 1st and runs until January 31st. If you enroll by December 15th, you have coverage on January 1st. You'll be able to look at the plans and pricing without creating an account, and those plans are going to be available shortly before open enrollment begins. I should say the SB 57 rules apply to all Utah individual plans, not just the ones sold on healthcare.gov, including grandfathered in plans. So we're going to talk about how this has gone in other places around the country. Utah was number 37 to pass a mandate like this. Hawaii just passed their bill, number 42. So in other states, you guys recognize that guy? Indiana passed the first bill in 2001, and there was some imprecise wording in the bill, which led to insurers refusing to cover ABA. It was corrected 5 years later by the insurance commissioner. In New York in 2011, they passed a mandate, and the very next year in 2012, the New York Department of Financial Services ruled that ABA had to be provided by state licensed providers. And I think, so basically they had to have a state license and be like a psychologist or something. And there was no New York license. So there were, they had to have a BCBA, and only a few dozen people in the entire state of New York with 20 million people could provide services. There was a revolt essentially, and a little while later that was fixed, but that's one of the stumbling blocks. In Michigan in 2012, Blue Cross Blue Shield required diagnosis at specific centers, of which there were 3 in the entire state of Michigan. This led to waiting times of up to 18 months to get a diagnosis. They've fixed that. I think they've grown to 10 or more, and things are getting better. This is reported from a survey I saw from behavioral therapists. They've seen services denied, including pre-authorized services. There's generally a lack of ABA knowledge and understanding and inconsistent policies and processes. That's kind of to be expected. These guys, they're used to in-clinic things. They're not used to in-home services, and they're frightened. It'll be okay. We'll work it out, but expect to be a little bit of trouble getting started. One nice thing about the autism waiver is that it got the ball rolling, and places like Adobe having coverage and Salt Lake County providing coverage. The insurers are getting used to it a little bit, so maybe some bumps have been worked out. In other states, they've denied in-home services. If you're getting behavioral therapy for your kid, you know that they need to get therapy where they need to work on the behavior. So it's in your home, or it's in the school, or it's on the playground, or wherever, and they're not used to that. Remote supervision is a thing that may come into play here in Utah. In rural states, it can be really hard to get access to a therapist. So providing supervision remotely is one way to get around that. I'm a little bit worried there may be a bottleneck in getting services just because of the lack of providers. There are essentially 100 people with BACB credentials right now, and they're all getting licensed right now through the state of Utah. Senator Shiazawa passed a licensing bill this past session, and so there's a way to do that now and a way to provide feedback and make sure you have a good provider. The University of Utah, Utah State University, Utah Valley University are all approved for BCABA programs or BACB programs. BYU is working towards one. So that's good news. And essentially, if there's a demand for services, then service providers are going to come in, and it's going to get better, but there may be a bottleneck for a little while. Every insurance policy has a process for review, and the Department of Insurance isn't really going to talk to you until you go through that process. You need to know you probably have a limited amount of time to contest a claim rejection. It might be 180 days from the time you get the explanation of benefits. the rules are going to be somewhere in your insurance papers. So if you do want to contest it, the Utah Department of Insurance can help with that. There's a phone number there. I've got links at the bottom of the page that'll take you to those things. In 2013, there were 180 claims complaints, and 132 of those were ruled as justified. So, it's not a huge volume, probably because it's a hassle to do, but it could be well worth it, especially if you're talking about a good deal of money. I just set this up yesterday. On our webpage, we've got report an insurance issue. So it's a little Google form where if you have some kind of problem, you don't have to wait till you go through the review process or whatever with us, partly because we can't really do much about it, but you can tell us what's going on. Tell us who your provider is. Tell us, I'm having trouble getting a diagnosis, or if they rejected your DSM-4 diagnosis, I'd kind of like to know, what are the insurance companies doing? And feel free to use that as much as you want to. There's not a ton of stuff there, but also if you have self-funded insurance that doesn't cover autism and you'd like somebody to talk to your employer, maybe we can help. And there's a pathway in there to say that and contact us. So you guys probably all know it's hard sometimes coping with autism. You may have tantrums and sleep trouble and comorbid conditions and all this kind of stuff. It's hard to find time and energy just to, put dinner on the table, much less go and advocate. It's not easy. We're a diverse group. Social skills may not be our strong point. Public speaking for me is not particularly a strong point. Autism groups have worked since around the 1970s to affect public policy with ADA and IDEA. They made, good attempts. It was not a large-scale thing. With the internet, people have come together. We're, able to organize and, use Google and make slides and find out information and share it with each other, and that's been a big help. Autism Speaks. So in the past 10 years, this is amazing to me. In 10 years, this organization came along and they devoted a lot of time and energy into affecting public policy. It's like 2 orders of magnitude more like spending on lobbying and the efforts in Congress. Autism coverage in 42 states, plus some other places. TRICARE coverage for military families. They've been working on the Medicaid coverage. That's part of the reason why this is here. The Autism Cares Act, ABLE accounts. So ABLE accounts are one of the things that just passed this past year. They're like 529 college savings accounts for people with disabilities. It's not just autism. It's anybody who has a disability. And there are certain conditions to it, like it has to be something that came on before age 24 or something. But this is really great for the parent of a kid with autism or another disability to know that you can plan for the future in the same way that you would for your college-bound kid. You can put away a bit a year. It's $14,000 a year, I think, and anybody can contribute to this, grandparents or whoever. It's after taxes, so it's not, you're not getting a huge boost there, but you accrue interest without being taxed on that. And you can have money in that account up to, I think, $100,000, and it doesn't count against eligibility for programs like SSI and other things. And they can be used for education, for medical expenses, for transportation, for housing, for basically everything that a disabled person needs. And it's a really great thing. Passed in December. We got it passed here in Utah. You have to implement it in every state. That was kind of a surprise, but we did it here in Utah, and it was great to work on. There are a couple of other things going on. Avante's Law. I don't know if you guys know about Avante Akindo. He's a young man and a teenager in New York who wandered out of his high school, and they found him dead a few days later. Avante's Law is trying to address wandering. I think it's a good thing to work on. 21st Century Cures is about kind of affecting the path for how something becomes a medicine or a treatment. Those are all big things that Autism Speaks has been working on. So we face a lot of challenges: healthcare, education, jobs, housing, wandering, police interaction, and planning for a lifetime. 1 in 54 may seem like a lot, but it's not when you're trying to change public policy. So we need to stick together. Go to utahautismcoalition.org and you can sign up. We won't pester you. It's just kind of an email list, and let you know if there's something that we'd like to work on.